I serve 3 churches in north central Arkansas up by Melbourne. We live kind of in an economic depressed area up there. We've lost 3 major businesses over the last several years. I got a story about 2 people that have exactly the same thing. One is insured, one isn't insured. Some of the thunder's already been taken because I'm going to repeat some of the stuff that's already been said. But paying for this is a very important issue. And it's a very serious issue, and there's an awful lot of money that's in there. But paying for something that's broke, and if it stays broke, doesn't make any sense. I have a lady that is 56 years old, lost her job when one of the plants in Melbourne shut down. Just like the lady said here, you know, COBRA's there, but if you don't have a job, you can't get your insurance. While she worked there, she had a procedure done where a piece of mesh, I don't understand all this totally, and I'm not a doctor, a piece of mesh was put around her colon. 7 months ago, she began to have problems. Without any health insurance, she went to local clinics. They did some work there, and they couldn't figure out what was wrong with her. They tested her for cancer. They did other things. Eventually, they sent her over to Nashville at a hospital over there that's a research hospital that does a lot of this stuff a little bit cheaper because of those folks that have no insurance. And it's a training hospital too, so I'm assuming that there's some people that are being trained to do some of the work, which is nothing wrong with that. While she was there, she had to stay in a motel for 3 days. They found out what this problem was. It wasn't cancer, it was this mesh that was causing the problems. She came back to Arkansas, went to a local hospital. She says they did 92 tests, and her bill is somewhere around $30,000. They found out that she's capable of having the surgery. She went back and contacted the doctor over in Nashville. Nashville said, well, that's fine, but you need to come over here on August 24th. We are going to run our those same tests over again because they will not accept the doctor's records here in Arkansas. Now, you know, that's a problem. That's a problem. So she's going to go back over there. Then they're going to run these tests. If the result's the same thing, then they're going to reschedule her again for surgery. She's got to come back to Arkansas and then wait for the surgery and have to go back over there. So far, she's spent somewhere around $55,000. Well, she hasn't spent anything, but that's what the bill is. Another lady has the same problem, but she works and is insured in my area. She actually worked for the state of Arkansas, and at some point the state of Arkansas at one time transferred some insurance from one company to another, and she has the same problem that this lady does. She went and had the work done, surgery was done, the bill came out to $72,560.82. And she thought everything was fine, and she got a letter from the insurance company. It says, I'm sorry, we're not paying one bill of this because you failed when you changed your insurance policies. You failed to list this on the application. It's a pre-existing condition, and they're not going to pay for it. It seems to me that if we're going to make this thing work, we have to be able to change the system where pre-existing conditions, those folks that, you know, if you lose a job and you can't get health insurance and you have these problems, it's just going to come back to haunt you. And these folks are honest people trying to make a living. And I believe that, you know, if duplication in tests, just like you talked about, all this duplication has to be done. If one doctor can't send medical records to another one and be accepted, all the money is not going to change the problem. We've got to fix what's internally wrong at the same time along with funding. And I think it's very important that Congress is also aware of a comprehensive health insurance reform package that makes it possible for those folks that have had pre-existing conditions still to be covered by insurance. And I understand the insurance company's position. Their job is to make money. And the insurance companies, the way it appears to me, and to most of us, is the only way they can make money is deny claims. So therefore, if I can find any reason not to treat you, that's fine. Now, this other lady has already got a letter, was turned over to the collection agency, had 30 days to pay the bill. She has not done it. She has now been issued a, I don't know what the exact term is, but anyway, her property has been attached through the legal system. And it is apparent that if she can't get this resolved, they may end up losing their house over this deal too. Because she didn't pay in the 30 days, so therefore they put a judgment against her, and the court has issued a judgment, which means that any physical property you have that can be sold can be taken to pay off the debt. So I think it's very important that funding is very important, but also we need to reform the system on the inside so that everybody can be covered fairly and justly.